We're continuing the conversation on posture, and I'm over here doing Wonder Woman pose with Travis Perret of Exercise Therapy of Kansas City. So let's talk about this, right? Because sometimes if you have chronic pain, you can actually ease that with exercise.
Absolutely. You know, exercise geared towards posture specifically, just like Dr. Michelle Robin was talking about. But also posture is important not only for shoulder position, but hip position, knee position, foot position as well. And so the better aligned we are through posture, the better we feel, the better we move.
Okay, so I'm working on my alignment right now, but you brought Allison, and there are actually some seated exercise that you can do.
Yeah, there's actually easy exercises you could do to focus on your posture. And the first one we're going to do is you're going to put a block of some sort between your knees, a couch pillow, something fairly thick. You're going to sit up nice and tall, shoulder blades down and back, and then you're going to squeeze on that block with your knees, squeeze and release on that block. And you'll want to do that 40, 50 times. Get those inner thigh muscles to start working. So those help control hip position, which helps control back position, which helps control shoulder position. So when we come to posture, it's not just shoulders, it's back and hip alignment as well.
Okay, so we knew that whole head, shoulders, knees, and toes thing, but
absolutely.
that actually all lines up and that all plays a part in the posture?
Absolutely does, absolutely. And our kids learn, my 3-year-old and 5-year-old learned that in school. Now, you know, the ear, nose, you know, shoulders, knees, and toes kind of deal. And we've got to look holistically at how the whole body's fitting together in order to help it move better.
Okay, and is there anything else that we can do from a seated position to help maybe some of that knee pain or hip pain?
Yep, the next one, we would take that block out. We would do a little twist where we're going to cross one hand over to the knee, pull this one behind us. Again, shoulders back, chest up. And so we're going to hold this for a minute on this side, and then we'll go to the other side, and we'll hold this for a minute on the other side. So our knees are staying even.
Okay.
You don't want the hips to shift. This allows that low back to rotate. And then after this one, we would follow it up with we call it sitting cats and dogs. So you roll the back and stretch that out. Yep, and then bring that up, roll the hips, shoulders back. So when we do a twist, we're working one side and then the other side. This works bilaterally with your low back and your hip position to get those spinal muscles, kind of like, again, Michelle Robin talked about with spinal hygiene, getting those muscles to work better and to operate better. So.
Well, this move is awesome because it sort of just wakens up your spine so you're ready to stand up straight. And you actually have some standing motions for us.
Yep. The next two we would do is we'll actually have Allison stand right here in between us. We're going to put this block between her knees, and she's going to put her arms out. Yep, and she's going to do little circles going forwards so that you'll notice that her shoulder position, her back position, it's all nice and lined up. She'll do 30 extra circles this way, and then she's going to go palms up, circles backwards.
And what does this help with?
This is going to help with that shoulder position, that mid-back position, but also having the block there, it keeps your feet straight, knees straight, hips straight. So it sets up a good foundation, allow your spine to sit on that. So if you're having back issues, lots of times that's coming from, you know, hip imbalance. This will help your hip imbalance, which will help your back feel better.
And you probably shouldn't do it with heels.
Yeah, doing it with heels
on the ground.
Changes that alignment a little bit. Yeah, barefooted is best. And then we'll take the knuckles on the temple, and we're actually going to bring your elbows together and then all the way back. Yep. And so this puts a little bit more demand into those, you know, rhomboids, paraspinals, those muscles down your back, but having it with a good foundation of good hip alignment, good knee alignment, to look at that holistic approach. And when you have this load bearing better, it helps decrease osteoporosis. It helps, you know, prevent osteoporosis even from happening with better alignment. So.
And when do you actually recommend, real quickly, do we do this first thing in the morning?
Yep, first thing in the morning is the best time, but you know, with these 4 or 5, you could do them 2 or 3 times throughout the day as well to kind of, you know, if you're sitting all day, do them, it'll kind of counteract that negative from sitting. So.
Well, Travis, thank you so much for all of that. We really appreciate you and Allison coming on. Well, he transforms